Webinar of the Quality and Safety Network. In the name of Hope and PACS, we welcome you all to this webinar. Just a quick reminder, so the objective of this Quality and Safety Network is to share best practices and experiences about patient safety and quality of care. And we know that sharing best practices is one of the most effective ways to improve our health systems. So there you go. We'll focus this time. We're talking about Medaille, a medication safety system, and we have two speakers joining us today. First of all, Remco, who will be talking about Medaille specifically, and then Clever Tolley from the University of Medical Sciences, Newcastle University, who will also be sharing their experience with some data, and then there will be a third part about the implementation of the Medaille system in practice. So without further ado, I'll let Remco take the floor. Thank you for joining us all, and I hope you enjoy this webinar.
Thank you, Laura, for the introduction. So we'll start off with a short introduction of the Medaille system. I'll walk you through that. After that, Claire will tell you about the study we did in Newcastle, and we'll end up with the implementation of Medaille in a long-term care facility in Belgium. So for starters, something about Medaille. Where Medaille came from is the people that are behind Medaille have a long history in medication safety processes in hospitals. So all the things we did in the past to improve medication safety ended somewhere near the bedside. So we did a lot of implementation on e-prescribing, on order entry, on hospital pharmacy systems. But once you're at the bedside where everything should come together, then there's this final step you have to take to improve medications, such as dose checks, double checks, all the checks you need to do to be sure you give the right medication to the right patient. And that's where Medaille comes in. So typically at the bedside, you have when you, as a nurse, you want to administer the medications. There are a lot of disturbances during the medication round. So there's patients asking questions. There's family and relatives. There are pumps and other stuff that make noise and ask your attention. And in the meantime, you have to make sure you give the right medication in the right dose to the right patient. So there's a lot of disturbance while you try to figure out which medications to give. You have quite some checks you have to do while you do your medication rounds, and you have to check your patient timing, etc. So these are the checks typically you have to do for each administration per patient. And when we talk about Medaille, Medaille is meant to automate and help the nurse as much as possible doing these checks. And of course, we want to do that for every medication at the bedside that possibly a patient can get. So it's for pills and capsules. It's for on the left side you see also the Medaille scanner. So we have Medaille as a combination of hardware and software, where the hardware is the scanner, the pill scanner, the barcode scanner, and an external camera for taking pictures. And with these three devices, Medaille can help the nurse to do every verification of every possible medication. So here you see so what Medaille consists of is again it's all mounted on the medication card of the nurse. I don't know if every hospital has medication cards, but at least the ones we have visited, they do. And the Medaille software we'll see in a minute is how you see the medication administration displayed within your own system. So first of all, we go through the typical different medications, and the oral solids are the first one to look into. So as I said before, the people behind Medaille, we have a long history in automating medication safety processes, and one of the first options to improve medication safety at the bedside is use barcode scanning. Of course, the downside of a barcode scan is that if you scan one typical pill or a blister pack, then it doesn't say anything about the dose. There's where the Medaille scan comes in. So the Medaille scan is a pill scanner where you put all the tablets and capsules inside, and the Medaille scanner scans the content of the tray that's put in, verifies which medication is in there, and verifies if it's the right medication, the right dose, right time, and registers it back into your host system. So, but when there's a deviation or something wrong in the scan, then Medaille tells you by a red rectangle on the wrong medication, which medication you should get out, which one's wrong. And if you have corrected that, then again you have a green scan and you can register back into the EMR host system. So how does this Medaille scanner, pill scanner work? You put all the pill scanners in the Medaille scanner, and this is where you get a lot of questions from. It's how this actually what it does. It takes a lot of pictures and creates a 3D image of each and every pill inside the tray. So it's not you don't do a scan per pill. You put all the pills of that moment in time into the scanner, and it automatically will detect all the pills in the scan. And this is, well, to show you that the Medaille scanner can verify all different types of tablets and capsules. Also, when you're talking about half or quarter tablets or any size or shape, the Medaille device can handle those. Then another way of handling oral solids, and this is what we implemented also in the long-term care facility in Belgium, which we will address later on, is prepackaged medications. So these medications come in pouches or in blister packs. The benefit of this is these packages have a barcode on it, and Medaille can scan the barcodes from the barcode, see what's inside the package, and then verify the medications in one go. And when there's an error in the pouch, so there could be that the medications are packaged, and in the meantime, the physician changed one of the orders. In that case, the nurse is asked to open up the package, put the content into the Medaille pill scanner, and the pill scanner will verify which medication should be taken out. And then again, you have to check your medications, and you can safely give the remaining medications to the patient. But when we have had the oral solids, then the next big group of medications we then identify are the high-risk ones. So of course you have also oral solids as a high-risk medication, but those are already handled with the pill scanner. Now we're talking more about the syringes and infusions, that kind of stuff. And typically, most of these medications have a preparation phase before the administration phase. And in the preparation phase, medications get a label on it, sometimes handwritten, could also be a printed label. What we then add to that preparation phase is a barcode on the label. That can be a label, that can be a barcode from Medaille, but you also the barcode can also be created by systems like Cerner or Epic or what kind of host system you have. The benefit of that barcode on the prepared medication is that we can verify that at the bedside. So we can scan the barcode, first of all, of the patient, of course, then of the label of the product. And from that barcode, we know which medication it is, which route it should be given, which the right dose, of course, and if this expiry date has not is still valid. Oh, here's an example of such a Medaille barcode, but Medaille can also work with barcodes that are created from systems like Cerner and Epic, as I said before. While we have barcodes, of course, it's not the total solution. So sometimes you need also not only check the right medication and the right dose, but also need to check the pump setting, for example, or the rates. For that, you at most hospitals, most situations need a second nurse or a colleague to verify and witness if you did the right thing at the right time. And it is time consuming, and you have to have your colleague always near, or you have to find someone. To make that a little bit more easy, we have created like a second nurse, so to speak. We call that remote verification, and remote verification really is nothing more than taking a picture of the thing that the check or the verification need to do at that moment. So if you need to check the pump setting, then take a picture of the pump. That pump setting will be automatically checked by Medaille, approved, and be registered. And of course, if that's something that's wrong, Medaille will give that back to you and say, well, you have to adjust the pump setting or anything else. So to finalize this one and the introduction of Medaille, I wanted to share you some screens of a typical Medaille implementation from a Dutch hospital. So this was like a pilot period. We implemented Medaille on 2 wards for like almost 100 days. And typically in this is what we see more often in at least Dutch hospitals where we implement Medaille. The number of stopped medication errors is around roughly 1 to 2 per day per ward. And well, here it was exactly 1.75 per day. So same as almost 3% per verification. And this is how this looks like, how this a scan of an oral solid looks like. So as I told before, you can put all the medications of this particular administration into the tray. And Medaille will show you which medication should be taken out. So on the right side, you see this metformin at 850 milligrams was put in a tray, but there was a 500 milligram prescribed. So Medaille will typically tell you that the medication in the tray looks more like an 850, where a 500 milligram was expected. And ask you, are you really sure you want to give this medication? Where we talk about hybrid medications, this was a different implementation, where we did a pilot for a period of 10 days on one specific ward. We saw like there were almost 1,000 high-risk medication administrations done with Medaille, giving the hospital the absolute reassurance that these administrations were given safely to the patient with the correct medication, correct dose, etc. So this is also a reassuring system for to be sure that also high-risk medications are safely given to patients. Finally, one thing also, when we demo the system, a lot of questions we get from how long does this the scan take, and is Medaille working with Medaille faster or slower than without Medaille? So we did some. This comes from one of the implementations where we see before Medaille, and sorry for the Dutch in there, but before Medaille is a red line with the average administration time per patient. And you see, once we started implementing Medaille over there, you saw a decreasing line. So the time spent on medication administration went down. So releasing definitely time for nurses to spend on other activities than medication administration, but still also improving safety. So and saving time and improving safety at the same time. These are some quotes from interviews we had with nurses from wards where we implemented Medaille. 75% of the nurses say that the better verification increases medication safety, which is of course true, but also that Medaille indeed can improve patient care, and that they like to use Medaille, which of course for us very important to know. Okay, I think this was my side of the first introduction. I think now handing over to Claire for the Newcastle.
Thank you very much for joining this webinar, and thank you very much, Remco, as well, for giving us a good overview of the Medaille system. So I'm going to talk a little bit today about Newcastle Hospital and Newcastle University's element of this project, which focused on the proof of performance of Medaille in a UK hospital. So first of all, I'll give you an overview of the programme of work, followed by looking at the impact of Medaille on administration errors. Then generally more about the impact of health information technology, HIT, on nursing efficiency. And finally, talking about some of the barriers and facilitators to implementing Medaille in the UK hospital. So just to begin with then, the primary task that all elements really hinged on in this project was integrating Medaille with a large commercial electronic health record system. This was the first time that Medaille had been integrated with this system, and it required a bespoke solution that required collaboration between Medaille, Newcastle Hospitals, and also a third-party company. It was definitely a huge achievement and at times posed many challenges, but it also ultimately proved that Medaille could be successfully integrated with this global commercial EHR system. In addition to this, we also investigated the impact of Medaille on errors, HIT more generally on efficiency, and then the barriers and facilitators to the whole process. Finally, we explored the impact of Medaille on costs as well. The analysis of this is ongoing, but we hope to have the results within the next 3 months or so. So to begin, we conducted the first evaluation to assess the impact of Medaille on the number and type of medication errors in one of the largest NHS hospitals in England. We did this by conducting a pilot before and after study and performed data collection on one ward 4 to 6 months before Medaille went in, and then also 1 week after the implementation. The post-Medaille data collection, it's fair to say, was less than originally planned, partly due to delays with the implementation part of the work, but then rather unfortunately, because of the COVID-19 pandemic as well, we had to stop data collection. What we actually did was had observers who were nurses or pharmacists, and these people shadowed the ward nurses on medication drug rounds and recorded details about all solid oral dosage forms that were administered. And it's probably worth noting at this stage to say that Medaille kind of offers lots of different solutions, and the only one that we were testing in this project was the pill scanner. So we restricted it to looking at solid oral dosage forms. The observers were actually blinded to the medication, so that is to say they did not know what the patient was prescribed. And we then compared what was prescribed with what the observers saw administered and looked for any discrepancies, which we identified to be medication administration errors. In total, we observed 1,069 administrations before and 432 administrations after Medaille was implemented. And overall, you can see from our pilot study that the overall rate of errors did not change significantly. However, we did notice some small, statistically non-significant differences in omission and other error types. So these included things like dose errors and documentation errors, which we did feel was quite interesting, despite the low numbers. So to kind of wrap up that component of the piece of work, we found that the overall error rate did remain the same, and this was largely accounted for by the number of timing errors that were primarily related to the ward workflow. However, more positively, we did notice a slight reduction in the rates of omission and other error types. And it's possible that Medaille contributed to this because it alerts users if they have dispensed the wrong dose or wrong medication. And although we did not find that this was statistically significant, it's very likely that because we had a low post-Medaille sample size, that contributed to that. We also have think that the user interface possibly helped contribute to the reduction in omission and other errors, particularly because the user interface was described as being simple and clearly presented nurses with what they were due to be given at that time. However, we can't necessarily say this with a huge amount of certainty because with the limits on sample size that we had. So we definitely think there's a need to gather further information and do further research in this area, and we'd be particularly interested in looking at other drug types such as IVs and liquids using the greater array of Medaille technology that are now available. So the next element of this work was to look at the impact of HIT on nursing efficiency. So first of all, we conducted a large systematic review and found 21 papers that reported on nursing time spent on documentation tasks, and also 14 papers that reported on the impact of HIT on administration tasks. The papers overall had a global coverage and examined a broad range of different HIT systems. We've published this review so people can kind of go and get a little bit more information about the findings. But we basically set out to calculate the weighted averages for studies that investigated the same intervention and also used the same sampling unit. And overall, we found that studies investigating documentation time were associated with an increase in nursing time. This ranged from 5.1% for a CPOE, computerized provider order entry system with nursing documentation, to up to 46% increase in documentation for an electronic health record. We also calculated weighted averages for studies that investigated administration task time as well. And for this, we could only group studies that implemented barcode medication technology. However, for this, we did find a net time saving of 33% associated with this technology. So the second component of the work that looked at nursing efficiency, we set out to conduct a time and motion study to investigate how nurses spent their time. The aim was to conduct data collection before and after the Medaille implementation, but because of the reasons I've already mentioned, we were only able to collect baseline data, but I'll quickly provide an overview of those findings. We firstly considered two different wards. One was a surgical ward that used a system called Omnicell, which is an automated dispensing cabinet. And we also conducted data collection on a medical ward that had standard drug cupboards. We observed nurses perform tasks over 4-hour periods on each of the wards and recorded what they did. We then calculated the proportion of time spent on different tasks, and in total we conducted 42.5 hours of observations on the Omnicell ward and 40 hours on the non-Omnicell ward. Overall, we found that nurses on the Omnicell ward spent significantly less time on medication tasks than nurses on the non-Omnicell ward. However, nurses on the Omnicell ward did spend more time on documentation tasks. This process really helped us understand the nursing workflow and identify how Medaille could potentially affect efficiency, for example, factoring in the time taken to scan pills or to record administrations. I think it's really important to mention that ideally technology should help nurses spend more time in direct care, but we definitely need to conduct further post-Medaille data in this area. And then the final component that I'll talk to you about today was a qualitative study that we did to understand the learning points and recommendations to support future implementation of Medaille and other closed-loop medication administration solutions. So we conducted some semi-structured interviews with key stakeholders and also conducted some observations as well. We asked participants about their experiences of the process and any barriers and facilitators. Overall, we identified 8 key themes, which I'll go through in more detail shortly, and these all related to an established socio-technical model. Great. So the 8 key themes are outlined in the headings above, and this is from a published thematic framework around socio-technical, which is a socio-technical model. Ultimately found that the process was generally complex and all elements were interrelated across the themes. Factors relating to the clinical content of the system included differences that were discovered between the format of how medications were prescribed in the UK hospital compared to other European hospitals that had implemented Medaille. Participants also described some challenges building the new medication database that needed to be used. There were significant challenges related to the software and integration between the commercial electronic health record system and Medaille, which was attributed to some of the delays that were encountered. The human-computer interface was described. In particular, it was noted to be clean, simple, and very easy to use. We also found that participants were generally enthusiastic about the system, but some stakeholders felt that the hospital would have benefited from more dedicated IT resources allocated to the project overall. So to conclude, we were the first hospital to implement Medaille integrated with the commercial electronic health record system in the UK. And we had some very positive early findings from our feasibility study on the impact of Medaille on medication errors, particularly those error types that are more likely to cause harm, so the dose error types and the wrong medication, etc. But we definitely need further research here, covering a wider breadth of medication types as well. Our work found that HRT had a varying impact on nursing efficiency more generally, and we really believe it's important to research the impact of Medaille moving forward on task time. And our qualitative work revealed 8 key themes related to the implementation of Medaille, and these had a strong focus on socio-technical aspects. Thank you very much for listening. I think that probably closes the presentation for me to an end.
I think it's back to me. So unfortunately, the people from PharmaFiles couldn't join today, so I will tell a little bit about the implementation of Medaille at the long-term care facility at the GVO, which is the facility. We did this together with PharmaForce and GVO, and I will try to tell you the best I can. So before we started the implementation at GVO, the GVO organization has 9 locations in which they take care of elderly people. They have a electronic medication ordering system in use, which is hosted by PharmaForce, and PharmaForce is also the company or the pharmacy that delivers the medications in a packaged form. So they have multi-dose pouches or bags, which they deliver to the 9 different sites with GVO. Before we started GVO, nurses still use a paper EMR at the bedside to administer the medications. So they had no automated verification system in use at that moment in time. So the goals that we see that were set that we wanted to achieve is that allowing nurses to safely remove incorrect pills from a multi-dose bag. So when there was a wrong pill in a pouch without Medaille, it's a quite risky workflow to get the right pill out of the bag. So that's something to improve. The transition to be made from a paper EMR to a full electronic EMR system, meet inspection guidelines for high-risk medications, and increase medication safety and save time for nurses. So that's one of the most important goals to achieve. A little bit about the workflow that we introduced at the bedside. Well, this picture is roughly the same as we saw in the beginning. So at the bedside, we want to help nurses to verify medications without any paper records, etc. So in a schematic overview, so you see here from the left top, you see an example of a medication bag which contains the pills and capsules of a particular patient for a particular moment in time. So a specific medication round. And if that medication is all correct and you scan the barcode, it will say it's correct. Then in one go, Medaille will say it's all verified and make all the blocks green, as you see in the top right corner. But if it's incorrect, so there's a wrong pill in the bag, then the nurse is asked to put all the pills into the Medaille scanner, scan the medication, and you see in the middle bottom window that the Medaille will show you which tablet to take out. So you fix your error in the bag, and then after that you can verify again and verify that you have now the right medications in your tray to give to the patient. So this is roughly the workflow we wanted to introduce at GVO. And some of the results that we've found is from day one, the nursing staff could verify all the bags. And from all the bags that were verified, more than 90% was okay, which is of course a little bit what you also would expect. And only for 5% approximately, a portion of the medication in the bags were wrong, and so those content of those medications should be put in the pill scanner and verified. And when we put the medication in the scanner, this is what the nurses found while scanning the pills. So we had pouches or bags with a wrong time for 18%. Some of the medications in the pouch were discontinued. That's almost half of the wrong bags. And in some cases, around 35%, all medications in the bags were discontinued. And most of the times, of course, it was on one type of medication in the bag. And here's the graph of the number of medication errors that were stopped by the Medaille system during implementation. And this is a rather long period of time. This goes from September 11th in 2018 till August. So it's roughly not nearly a year. You can see here halfway a increase in the number of errors stopped. And that's when we stop the pilot and start rolling out the Medaille system over all locations of this long-term care facility. And these are some examples of stop medication errors. These two of them. And something to add maybe here, you see around the lowest yellow pill, some remaining crumbles of former medication. So in this case, we should ask the nurse to replace the tray with a new clean one, which they're always instructed to do. So we always ask nurses to use the same tray for the same patient. So each patient has its own tray to prevent contamination of drugs between patients, of course. Scanning the medications, the verification of medications was one of the goals. The other one was replacing the paper system with an electronic medication administration registration system, which then we as Medaille also developed, giving now the nurses and also management the overview of which medications were given. And what you see here is the overview of a typical day for a patient. So this is on a patient level. And the numbers you see inside the green and red boxes are the number of administrations or the number of medications that should be given to the patients. And of course, when it's green, it is given, or they are given. And when it's red, one or more of the medications are not given yet. So this gives a lot of insight to the also for management and for nurses, which patients still have to receive some medications. This is an example of a report Medaille can build for families and doctors to see how many medications are given. So and one of the remaining goals was besides stopping the errors and creating the electronic medication administration registration system, is reducing time to care. So what Pharmaforce did was did a pre-pilot or a pre-implementation study on the time spent on medication administration, and from which I found out there were roughly 70 seconds per patient spent on medication administration per round. And we did also a post-implementation research, and we found that with Medaille, this was brought down from 69 seconds to 56 seconds per patient. So it's almost 20% reduction in time needed to do the medication rounds. So less time, but also with a higher medication safety. And so you catch errors and release time. So to recapitulate on that, we have improved medication safety at GVO. So that's also the reason for GVO to roll out the system over all 9 locations. We have introduced a flexible workflow. So now that you have all your checks and balances on the end of the process, you're quite free in how to optimize your distribution processes. At the end at the bedside, you can bring it all together and do all your verification that is needed. There's accurate data because of the introduction of the EMR system, and it saves time for nurses. Time for questions.
Yes, so we'll be handling the 2 questions that have been submitted in the chat. So first is, I suppose Medaille has produced a clinical safety case report or a hazard log. What have been the major risks or hazards identified for this process? So most important hazards identified.
I'm reading through the questions. Well, of course, before we start a Medaille implementation, one of the things we do is create or make or should do is a risk analysis report. And in this risk analysis, of course, and it's primarily for the pill scanner, and of course, for every verification system you use, there's a risk of a false positive and there's a risk of false negative, and that's no different than with the Medaille system. But we always find out is that the risk of a false positive is far less or lower than the chance of giving a wrong medication when you would not use Medaille. But we do run these hazard logs or the safety case reports, as you call it. Does it answer the question?
For me, it does. Maybe the second question. So how does Medaille handle once only meds? Do they need to be entered in the scanner first? And is that process time consuming?
So what we try to do, and then something somewhere in the middle, I note if I had this picture of a worldwide database. It's something that we created also during the Newcastle project. What we try to do is create a worldwide database of medications in which we can that we connect to the different coding system in different countries. So a once only med, hopefully there's not much of them around, and per country, so to speak, we try to have almost 100% coverage of medications that are available in the country.
Good, thank you. Then Claire, there's one question for you. Is Newcastle NHS Trust complying with the standards?
Thanks for the question. I will have to defer that one to the hospital informatics team. So I don't actually sit within the hospital, so to speak. I've collaborated obviously with them on this project, but I think I can probably get you an answer, certainly, Zach, for that. Remco, I'm not sure on the last one. It's possible that Zach actually was talking about maybe once only medications in terms of things that are just like a one-off dose, so stat medications that we came across. I think that's possibly what the question was around.
Maybe you can help me here, Claire. So what is the...
Yeah, so for example, if there was just like a one-off dose of an antibiotic prescribed, just like a one-off dose. Yeah, yes, exactly.
Now, what you normally would expect, or what we do expect, is that you have like an as needed or a PRN medication order for those type of medications, the medication administrations. But also,
yeah, so you had the as needed ones, and then sometimes there would just be items that were prescribed. I mean, I can have a go at answering from obviously experiencing with the system. Basically, if the item is prescribed, Zach, the Medaille would look for any kind of current orders, and if that happened to be an IV stat dose of an antibiotic, you would be able, the system would look for that order in the system and just validate it as normal.
Okay, does that answer, yes, the question I see? Okay, thanks in the comments. Does anybody else have another question? I'll let a few seconds for people to raise their hand or chat in a question. No? Okay, well then, I will send out a little evaluation now, starting. Everybody can click on some evaluation of this webinar. I would like to thank our two speakers of today for their input. It was really rich. Thank you for your participation. And for the next webinar, we can also announce that it will be about a regional strategy for patient safety improvement. It will be about an experience of how we developed this strategy. So if you're interested, feel free to connect, of course. And then I thank everybody for connecting in these times, and we'll be sending out the recording of the webinar, so you will be able to share it with your colleagues or send back some feedback about it, or maybe additional questions for our speakers, who I once again thank for this webinar.